All right, I'm going to call the meeting to order. It's a little bit after 2 o'clock. And I'll call the roll call, beginning with myself, Marion Abadi, present. Dick Cooner.
Present.
Dr. Ed Copeland. No, he said that he had a family emergency. He may not be here, and I didn't hear back. So Danielle Angelari.
Here.
Dr. Bill Gorski.
Here.
Dr. Terry Giardini.
Here, but I can't see anybody.
I know. Usually your face is there. Dr. Julie Morris.
Here.
Tim Neighbors. Linda Sandquist.
Here.
Advisory members are Wendy Larson Bennett.
Present.
And Jay Ware. Okay. To my knowledge, as of yesterday, we did not have a request for public comment. Jason, any updates? And by the way, I should introduce that Jason Holcomb is present as well. And welcome also to Andrew. Let me get that pronounced. It's Mueller from the State's Attorney's Office. So thank you for being with us today. No public comments, so we'll move on down to the first action item, which are minutes from the last meeting. So I'm going to need a motion for approval.
I move that they be approved.
Okay, Dick moved. I need a second.
Second.
Dr. Gorski seconded. All those in any discussion? Hearing none. All those in favor, please say aye.
Aye.
Opposed, same sign. Okay, minutes are approved. Moving down to the second action item, and that's our legal counsel procurement. And I'm going to turn that over to Jason right now.
Sure. So I wrote a memo. I hope you had an opportunity to read it. I apologize for not getting it to you sooner, but this was a quick turnaround time on this. So just to give you a brief summary, the state's attorney's office has recused themselves from representing the mental health board. I assume this might be Attorney Mueller's one of his last meetings with us. And so we do need to seek independent legal counsel. It's documented in the memo, essentially, that we try to take a methodical and very unbiased process to this, conducting some independent research, reaching out to all of the board members for suggestions, attorneys and law firms that may have the type of experience that would be necessary to represent a public board with specifically focused on mental health. And as such, there were 5 total law firms that were identified that had such experience or were thought to have such experience, and 4 responded to outreach calls, and then in turn presented us with information based on a standardized list of questions that were sent to all law firms in the same manner. So with that, there is a matrix that was created along with attachments that show all of the specific answers. And there was no information that was provided to me that is not represented in this packet. And based on those responses, I have made a recommendation to the board that they hire Zukowski, Rogers, Flood, and McArdle law firm out of Crystal Lake, Illinois, based on their extensive experience having represented a mental health board, having worked with them on their funding policy, funding agreements, which is really our immediate need as a mental health board to develop those contracts. You know, it certainly helps that they also came in at the lowest rate. So there's really no, in addition to being the only law firm with that very specific type of experience, although all of the law firms certainly were more than qualified to handle public sector issues more generally, none of the other firms had that specific experience with mental health boards. So I do think that in combination with the lower rate of service really makes it a good fit.
And could I just add to that, because I've really spent time going through all of these bids as well and looking at the expertise. And to be honest with you, the law firm that Jason's referring to, they are the only ones that claims to have any expertise in the Community Mental Health Act. That's a very specialized kind of law, not, you would take time to bring others up to speed, I think, in terms of understanding fully what, how this has all been pulled together. And more importantly than even that, although I think expertise in the bid is important, but what really convinced me that we should really consider this law firm over the others, in speaking to lawyers in general, the big, I think the big challenge is conflicts, because a lot of these law firms that were, they're the top notch law firms in Rockford and Winnebago County. They represent healthcare systems as it is. And even if we retain this, we are a small player comparing us to any kind of health system in terms of, they're not charging us the same rate they would be charging the health system. Plus, they're not going to be billing as many hours for our work as what would happen with the major health systems, or for that matter, even any of the other possible agencies that we're funding. So looking through the other law firm, they sent letters of recommendation and so forth. They don't represent any one of our local healthcare systems. And so we would have to go through a waiver process, get that all spelled out in front, that, that would be understood. It's not just easy to do that. And for what we need right now, the expertise in terms of what I read through and spent a long time, it's really kind of overwhelming evidence that the law firm that Jason recommended is by far meeting our needs. But that's my opinion, given my review of all of these bids.
Well, and Marianne, I have to agree with you, but also it's not just the healthcare systems. I'm familiar with some of the attorneys and some of the other firms or the large firms. There's more than just the healthcare systems that pose potential conflicts.
I agree.
And it occurred to me that some of the law firms are kind of political, and we don't want to get in the middle of that. I think we've walked a very clear line of trying to stay
above the fray,
above the board, transparent, not get sucked into political wrangling. Mm-hmm. And I think the firm, they seem to have good experience, but also they might be involved in politics in McHenry, fine, but it's not going to impact us. So I second your ideas.
Let me just note that none of the law firms, including the one that was recommended, required any type of minimum retainer or contract. So this is not a permanent decision. It does not necessarily even have to be a long-term decision, but it's something that we can try out. And if the firm that we choose does not meet our needs at any point in the future, there's certainly no restriction to changing.
Do you need a motion, Marianne?
Yes, we certainly do. I didn't know if go ahead. And then
I would just to formalize any further discussion, I would move the selection of, is it Zukowski, Rogers, Flood, and McCardle?
Yes. Do we have a second?
Our attorney?
I'll second it, Julie.
Okay. Any further discussion? Comments?
The only thing, I suspect they may they may send a retainer letter, and I think the board might want to authorize Jason and/or Marianne and Dick to sign some agreement that they are going to be our attorneys and, what the rate of reimbursement will be, just to get off square one, to make it a formal contract between us. It doesn't, I don't think it will obligate us beyond now they're our attorney.
So would we amend this motion? If
No, I would make another motion, ask
Okay.
somebody to,
Okay,
I would just make a comment that Marianne, your and Jason's experience and endorsement of them is very powerful and makes a lot of sense. I only say this, and I don't know if anyone would push back at all that we're, sending dollars out of our immediate area. But that sounds like a very easily answerable question relative to potential local conflict and the need to avoid that. So I think it's a great recommendation for all those reasons. And I think if that should percolate up, then that's the appropriate answer. That even for those firms, it puts them in a difficult spot as much as it would put us in a difficult spot.
that's exactly right. And that is my first reaction, Phil, was, we should not go out of our city or our county. But then getting beyond that, it's the expertise, and, we have to think about what really we need.
Yeah.
And we can't ever say that we're going with someone that's twice as expensive or anything else. I mean, they came in with the lowest
Right.
rate. So,
Right.
okay.
Right.
So any further discussion? If not, okay, all those in favor, please say aye.
Aye.
Those opposed, same sign. Okay, thank you. Moving on now to the program year 2022 grant application amendment. And Jason, I'll let you take this.
Sure, thank you. So one of the things that we've quickly learned from the grant application process is that there are an impressive number of organizations who intend to do collaborations, probably more than what I maybe anticipated as we were kind of developing this grant application. And so that's a great thing. What I recognize now is missed in the grant application was a question that allowed for collaborations to name all of the partners that are involved and to speak to essentially why those partners are involved. So I am recommending that we add a question group to the application process. And I will say that with the caveat that it will not in any way affect negatively anyone who has already started filling out their application. Nobody has yet completed their application. We can notify all of the people who have started their application of the new question, and in no way would it be disqualification or penalty for not filling out the question, but really this is just creating a spot for those collaborative applications to name all of their collaborative partners, which otherwise we really don't have a way of seeing. So I understand it's not the most ideal thing to add a question after the application process has already started, but this really is feedback coming from those who are applying. And since this is our first time through, I think just being emergent in our way of dealing with things and learning quickly from how people are experiencing our process, I think it is warranted to add the question.
And this
So-
item will need a motion.
And so I make a motion that we add an addendum to our process concerning collaboration and affiliations between applicants.
I need a second for this.
I second that.
Linda, thank you. Any discussion about this? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Thank you. Now moving into our discussion items. First one is our procurement policy, and I'm going to let Jason review
Sure.
with us.
We first reviewed this, I believe, 2 months ago and had some discussion about it. I have since followed up with Dr. Gorski and Reverend Copeland to have a deeper dive overview. And I think one of the recommendations that we've come up with for changing is, rather than outlining a specific process for public bids, that we allow for the mental health board to adopt the process of their fiscal agent. The mental health board itself really doesn't have the, staff, so to speak, to do public bids. So you'd either be using somebody else's process, whether it be the planning council or the fiscal agent, the health department, or the county itself. So rather than creating your own separate process that somebody else has to learn and then have two different processes that they use within their organization, we're, I think, suggesting that you have the ability to adopt the process of your fiscal agent. And so I added that language in here only for discussion today, because the other recommendation would be that we take this to the legal counsel and get a kind of review of it, and then bring it back to the board for final approval when it's ready to go.
Any questions? Comments?
Well, Jason, we didn't talk about that last comment you just made, and it's got me thinking a little bit. Is that, with the engagement of our new council, is that a reasonable thing to run by them? Since obviously they have experience with like entities like us elsewhere. It still seems to make the most sense to me, but is that a step that's worth taking? I don't know what the urgency is. Is there an urgency right now from a policy adoption perspective?
I would say the only urgency would be, we really haven't started to even get into some of the public engagement activities or dollars. And so I don't think it's like urgent as in it needs to happen before next meeting, but at least to maybe start the process of having it reviewed, so that when expenses, if something comes up that seems to be an expense that would fit within something like public engagement, that there's a process developed to make that decision. So, I mean, a short answer to your question, no, there's not an urgency to it.
Mm-hmm.
Well, and maybe I've missed a step here. Are we talking about us buying X large item and how we go about that, or how our contractors, the people that we are funding?
This policy is for the board itself making.
Okay, all right. Do we know what the health department's procurement policy is?
Well, this would only be the adoption of their bidding process, not necessarily their procurement policy at large.
Okay.
But if there were, and just to clarify, there are currently no expenses over $30,000 in the current year budget, so it wouldn't be something, that part of it in particular has very little urgency to it, because that's not something that's anticipated for this fiscal year. But the remaining portions of it, when we're talking about purchases less than $3,000, and the board president having the ability to authorize those purchases, that's kind of the more urgent part of it, or what's more relevant to this fiscal year at least.
Jason, I'm dusting off fuzzy memory on this. There's some exclusions, correct? Are professional services excluded?
Yes, professional services are excluded.
So the legal expenses would not fall under this, is that correct?
That's correct. And when the state's attorney called about the recusal, I did ask clarifying that point, and it was noted that that legal counsel is a professional service and would fall under that exception.
I do know that at one point, the county had sort of a bidding process for, things over a certain dollar amount. And I'm pretty sure the health department probably would be part of that. It probably would be useful just for me, I'd like to see it. I'd like to see what the bidding process is. I mean, I think it's reasonable to use whatever's already in place in the county. But I'd like to know more.
Does Andrew, by chance, would you be aware of that?
I'm not familiar with that bidding process, unfortunately. I'm just not involved with that.
That's fine.
Well, I do wonder, Jason, if running it by our new legal counsel, using our fiscal agent and their kind of overarching policy as our guidepost, if there's not something pending right now, I guess as of now, theoretically they're engaged. And unless others think that's an unnecessary step, it seems like it couldn't hurt too much to run it by them.
I concur with that. I think that's fine. Jason, is that something that we can afford to do?
Well, what was recommended in brief conversation with the attorney was, well, let me say it wasn't recommended, but in expressing how their firm has worked with McHenry County, they certainly recommended and noted that it significantly reduced the number of hours spent doing something when a policy is already drafted for their review rather than asking them to develop it from scratch. So I think since we have a draft, it would not be a significant amount of time needed to offer an opinion on it. And I don't think we'd be asking them to develop something from scratch, but rather to offer us an opinion.
Makes sense. So is that just another step in this approving the policy is to get a legal opinion? I mean, will you need any kind of action to get that done from the board or just direction?
Yeah, I think just maybe consensus that should be the next step of reaching it, getting it into the form for a final action.
So how do we know there's consensus? Does anyone have any objections, or is this the route we want to take, or do we need to?
I'd just like to make a motion
You want to do that?
that
Okay.
we submit our policy or draft policy for legal review.
Okay, do I have a second?
Second.
Carrie, did you second it?
Yeah. Second.
Any further discussion about it? If not, all those in favor? Okay, wait a minute.
Maybe if I've got this, confused, but this new law firm, well, if we're paying these guys, let's see what they can do for us. Let's put it in their lap and see what they say.
Well, it's an hourly rate, so, yeah.
Can't help that.
No, that's fine. I think this is a very legitimate way to deal with this, so.
I think
Communication with them.
Oh, I'm sorry. I think it's also fair to them that they understand that we have a policy we're intending to use. And so they kind of put that in the back of their mental bank that we already have one, and they've been able to review it and can say they reviewed it. Seems fair to them.
I think that's good. So we have a motion and a second, so I'll just move it ahead. All those in favor, please say aye.
Aye.
Opposed, same sign. Okay,
And that was a motion, a second for consensus. correct?
that was to move it ahead to for a legal opinion before we bring it back for an action item.
Perfect. Thank you.
Okay, moving on to our second discussion item, which is the funding agreements. Again, Jason.
Okay, So I believe that it was already implied and included in the motion to procure legal counsel that they would be reviewing the funding agreement. So don't think that we need to have the same consensus around this necessarily, but this is more or less just to give you an opportunity to review it. It's a 10-page draft. It's kind of upon review of other mental health boards, funding agreements, and trying to really include it as much as possible. And then with legal counsel, cut anything that's not necessary. There are some things highlighted in the document in particular that were questions that I wanted specific clarification around, or had specific questions about if that was necessary or what the potential value of including that is. And so I think if anybody had an opportunity to read it ahead of time and you have additional suggestions right now, those are welcome. But alternatively, if you want to email me any suggestions you have before the end of the week, that would also be sufficient. And then next week I could send it to assuming all of the engagement paperwork is done, we could give this to them next week for their review.
Excellent. And any questions or comments on that? If not, moving on to our third and final discussion item is the FY 2020 annual report. And again, Jason.
Yes, so this is for the past fiscal year, which for the board really was when you were formed in March until the end of September. And we did some review here of just the board's bylaws, also the Community Mental Health Act, and other mental health boards' annual reports to get some ideas of what other people are doing and also what's mandated. There's a few things in the outline that are in red, and those things are specific bullet points from the Community Mental Health Act that are required. So we want to make sure certainly that we're in compliance there. And then, some of the other things that aren't in red are just what we thought would be some of the best things to include to be transparent and informative to the general public. So this is just an outline form right now. We have actually already started a draft of it, started writing some content, but that's not done yet. What I would like to do is get any of the feedback you have on what type of content you'd like to see and have a draft to you maybe 2 weeks in advance of the next board meeting so that you have sufficient time to read the draft, provide feedback, and give us time to edit, modify, and present a final version at the March board meeting, at which point in time we would then also need to publish this on the website and also put a notice, a legal notice in a local newspaper. So I provided an example of what that's looked like for another public committee where they haven't published their entire report, but they've put a notice in the paper that shows people how to find the report. And you can see that that comes with a certificate of publication that essentially certifies that it does meet the Illinois Notice by Publication Act requirements. To put the entire annual report in a newspaper would be thousands of dollars versus kind of like putting this notice about how to get the report would be significantly cheaper, like less than $100 more than likely. So any thoughts? Yeah.
I'm sorry, Jason, you said already this is a requirement, correct?
Yes, it is a requirement, and it is a requirement that it be published in a newspaper.
Okay. Can you, the report shall show the condition of its trust of that year. struggling with what does that actually mean?
I think that's referring to maybe the amount of money that's in the fund.
Trust is a money term, not trust. Okay.
We did receive also a fiscal year report from the county financial department that Reverend Copeland facilitated to get for us. And so we have that in terms of the financial report, and will be in total alignment with the county's records of revenue received and expenses.
Do we have any idea what that amount is right now, Jason?
Through for the fiscal year or up until?
No, just up to today's date.
You know, I'd have to go back and double check, but I believe there's, as of the beginning of February, would be 5 months. And it's been coming in around 1.2 million per month. But I could certainly get you an exact figure, Dick, if you'd like that.
Oh, it'd be good to know.
Yeah. And Jason, in terms of the timing of this annual report, when do you think this will be published?
Well, it has to be published publicly before the end of March.
Okay.
It's within 120 days of the end of the fiscal year. So I believe that's the end of March, roughly. I mean, we could count the days to get exact. It's roughly 6 months. So if we have it ready for approval at our next board meeting, and
It'll be timely.
quickly thereafter, we'll be within the limit.
Good. Okay. Any other questions, comments on that matter?
I just had one, Mary Ann. You know, what it got me thinking about is once we begin to make awards, how are we going to publicize that? I mean, I guess, and I don't know if everybody would agree, I guess I'm thinking that the impact of this, we're hopeful, will be pretty profound in the community, and it would be good to get the word out. And I'm wondering if we've, how much thought we've given to who will assist us in that type of, I guess you'd call it public relations or marketing. And, you know, are we prepared for that?
Well, you know what, if I may jump in, if we're not, you know, when we did those little PSAs, you know, it's not difficult to get the word out through that sort of stuff either. If we want to try something like that, take that avenue again in some shape or form.
Hmm.
I think we need a more broad approach. I think a sort of a big splash press conference, maybe where we ask some of the executives from the winners or each of the grant recipients to be present, so we can really lay it out well for the community.
Yeah, and I agree with Wendy, and I have experience in that area, so I am happy to work with Jason or however we want to put that together.
I think I want to throw that I kind of like what Terry was talking about, that the PSAs that run continual are going to catch people that aren't necessarily looking at big press conferences. It's not an either or. I think it's more of a both.
I think that's true.
Yeah.
I agree. And I love, just if we didn't say it before, I love Mentally Healthy 815. I would like to see that be a regular thing that we're doing, because I thought it was awesome.
So one of the things we had in our fiscal year work plan was to do some type of communications campaign, for lack of a better word, during the months of, specifically in you know, June, July, when these awards go out, maybe even in May after announcements are made. And so I have an AmeriCorps member here that had some experience managing communications last year for a mental health agency. And she's been working on putting together some ideas for that campaign. So I think if there are board members such as Linda or anyone else that would like to be engaged in that, I'd be happy to show you what we've been working on. And the target for us was maybe to try to have something to you in April that would look like a pretty formalized idea of what we could do. But it sounds like maybe March would be a good time to have some more conversation about that, at least with an initial draft, so that we're not caught off guard and everyone feels like they have the opportunity to, I guess, give input to that.
Sounds like a great connection. And I have to comment on the interns. They've done some tremendous work, and they've been a tremendous asset in all of the strategy here and in gaining all of this, putting all this information together to help Jason. And it's pretty remarkable. So, any other comments on the annual report? If none, I'll move down to other matters. And there's a couple things that I just want to draw to your attention. Number one being the grant seekers meeting and the follow-up question meeting for grant applicants. And again, I want to commend Jason. These were all videoed, and he did an excellent job laying it out. I sat in on all of the meetings. Dick sat in on most of the meetings, and the recipients, or should I say the grant applicants were, they didn't have a lot of questions because Jason did such a good job laying it out. So that's all I can say to that. And I want to just let you as board members know all of this is going on behind the scenes, and it's so much work and preparation, as you can see. And I just never want to let it go by as just taking it for granted. So thank you, Jason, and your team for all of the work that you've been doing. And along the same lines, on February 11th, Jason, myself, and Dick are going to give the updated report. Thanks to Tim. Tim has helped us get the schedule with the county board because we promised to go back. We tried to do it in January. It didn't work out, but we have a date just to let them know about the progress that we've made and where we're at in the whole process. So if anyone would like to join us or be a part of that, I'm always willing to step back on that. But I just want to make you aware that this is also occurring. And the final thing that I have under other matters is Jason had sent out late yesterday afternoon the letter that we received from ICEJA, which is actually the Winnebago County Criminal Justice Coordinating Council. And they're doing a mapping of the sequential intercept model. And this is a very important project for Winnebago County, and it really does tie into mental health. I mean, that's the focus in the criminal justice system. So they are asking us for our raw data, and really we have a way of sharing that with them. And so we're just making you aware that we received the request, because they can FOIA this and go through that whole process. But we're working, for the same population, and we certainly don't want to put up any barriers. So we had some hesitation in the beginning because we just felt like, our focus is different, but, considering the big picture and creating a system of care for people with mental illness and keeping them out of the criminal justice system is a big part of this. So I think this is something that we should do. Legally they can do it. So why not help them? So
if I could just speak to it, because now I don't know if I've said this, I'm now working part-time as the training coordinator for the state's attorney's office. So I'm back part-time, but Jay asked me to be a representative on this sequential intercept model. And I'm just learning. Marianne educated me a little bit more the other day about what it is involved in this. But essentially what they are doing, they've received a grant in order to come in and meet with stakeholders who deal with individuals who are involved in both mental health, addiction, and the criminal justice system. And Danielle, this is what I want to talk to you about, because they're setting up a workshop in May and June, 2 workshops with stakeholders, because what the ideal outcome would be sort of, I kept saying it's parallel to what the mental health board is doing, but more targeted to the criminal justice population. The idea being that if law enforcement or the fire department ends up with somebody who's having a crisis and they deliver them to the emergency room, and the emergency room says, this is not a medical issue, this is a substance abuse issue. Now they might reject that individual. But with this concept of the intercept model, there would be no wrong door. Regardless of where the person shows up, everyone in the community would have an open door, and their dedication would be to getting the person to the right place that can help them. And paramount in that would be, hopefully, for most of the people that we're seeing, not the jail. The idea is to keep people away from the criminal justice system when their issues really lie in substance abuse or mental health problems. And I think that's a model we can embrace, because it seems to me, like I said, to be parallel to what we're trying to do, which is wrap people in services, the right services at the right moment. So what they're looking for is just who the service providers are, and they also want to identify the gaps, just like we have tried to do. They're going to be looking at it more myopically through the criminal justice system. But I think at the beginning, they're looking at it just like we are, which is where are the gaps broadly, regardless of who you are. And then they'll take it to a different place in the criminal justice system, where we're looking at a more broad community service model, I think. But anyway, so that's where we're at. And Marlena Docken, I know, I said to her to reach out to Jason. She did. Jason, I think, properly said, you better make a formal request so the board knows what's going on. So that's where we're at.
And which group is this? What's the organization?
It's the Winnebago County Criminal Justice Coordinating Council.
Huh.
So it's an organization that is made up of judges and probation officers and the state's attorney, and I'm not even sure who. It's a broad group of people. But then the sequential intercept model is something that has been created in a variety of communities around the country with some success, like what Jay Hanley has talked to me about is Pima County, Arizona, where it was so successful that the jail closed an entire wing because so many people were not being arrested anymore. Instead, were, getting the treatment help they needed because the community understood this is, an addiction problem. We need to have addiction beds for people. This is a mental health problem. We need crisis intervention. So I think it's
actually, I just want to comment that they're doing the mapping. They're at the beginning stage.
Right, we're at the very
ultimately, they could come to the mental health board with a proposal during one of our funding cycles, which,
Down the road.
yeah. So
How does this interact with what the mayor is doing with Rosecrans and his outreach? How does this interact with that?
well,
I
it
think that's a
really
good question.
it's an interception point, because whoever is frontline and first to meet or come upon an individual with serious mental illness that needs help, that's where they're trying very hard to get resources to individuals, not to arrest them. Same concept. I mean, it's like a funnel, and the interception points are, from it can be the fire department, it can be the police, it can be ERs, it can be, churches, whoever has the first touch with the human being, that, this whole concept, if it can be integrated in the community. So it's been around. Frank Ware, I want you to know, he was at the state of Illinois with the sequential intercept model way back 10 years ago. So it's the Gain Center really was the originator of this in Florida, and the criminal justice mental health expertise came out of there for it. But it's great. I mean, it's just another thing that, we may be taking a look at in a proposal eventually. But right now they're collecting their data. So
And I'm glad you mentioned the ER, Marianne, because just to clarify Wendy's comment, no ER can not take somebody in if they've been brought to them. That's
right.
Violates our federal EMTALA laws and all sorts of things. But the problem is, you want to do everything you can to avoid them having to show up there, because as many of you know, once you're in the ER, you enter into a system that is bound to get more complicated than it sometimes has to be. And then providing support to those ER people, because as you know, the major issue they often are confronted with is placement then at that point. Where does this person go appropriately? And so, ERs have to take folks in, but once they get there, the ER has to find an appropriate place for them to go, which satisfies their federal legal requirements. And oftentimes that can be very, very difficult.
Well, and I don't know if I was watching the news, I think maybe last night, and they were talking about a partnership between Rockford Fire and Swedes. And I thought, this is phenomenal. I hope they're applying for money.
Mental health cropping up all over.
We're the flavor of the month, people. But it was wonderful because they appear to have made the connection between physical ailments and mental health issues. And then you get your frequent flyers, and the idea is, I hope that we can sustain funding for those kinds of programs that keep people out of the emergency room, but connected to the resources they need, and I think that's our whole goal.
That's community support model, right?
That's it.
What you're talking about. So we're using it. Yeah.
Mm-hmm.
Okay. So any other matters? That's all I had for that. Hearing none. Can I have a motion for adjournment? This is Dick's job. You're muted.
He's muted.
You have it, Marianne. You go for it.
Okay. Well, I hate to say goodbye. I only see you once a month, and I like it. Mod.
Yeah.
I mean that.
So when's our next meeting? March
3rd, I think.
First.
Second, 3rd.
3rd is Wednesday.
Did we get a second, Marianne?
Oh, yeah, we need a second.
All right, hey, way to go, Bill.
I second it. Tell me I second it.
Bill, I get a lot of seconds for this motion. All those in favor, say aye.
Aye.
Okay. Thank you, Andrew.
Take care. Stay healthy, everybody.
Stay well.
Thank you.